Caitlin. My name is Dr. Michelle Thompson. I am the Medical Director of Lifestyle Medicine for the University of Pittsburgh Medical Center, an Associate Professor for the University of Pittsburgh School of Medicine. I'm here today joined by Caitlin Babinchok, our physician assistant and sleep specialist at the Lifestyle Medicine Department, and I'm going to let her introduce herself to you and tell you about why she has such a special interest in sleep and what we're going to talk about today.
Hi, everyone. As Dr. Thompson said, my name is Caitlin. I'm the physician assistant with the Lifestyle Medicine program, and I am certified through the American College of Lifestyle Medicine and also trained through the Center for Mind-Body Medicine as well. And I run a lot of the stress management, sleep groups, mind-body skills groups with the program, and sleep has a special place in my heart personally, and also with doing the groups. I just think sleep is one of the pillars of lifestyle medicine that truly impacts all of the others. They really impact each other. But just in my experience with patients and myself, I think if sleep is not going well, it's really hard to do well at the other pillars of your health. So I just think it has a big impact on it and a lot of other aspects of our life. It's really fun to hear people's improvements as we work with them as well. So I really love how much sleep makes an impact in my life. And so I love sharing that with other people too.
Yeah, thanks for sharing all of that. And I always say sleep is the driver of all health, right? So if we don't sleep well, we may not feel like eating healthy food choices. We may not feel like moving our bodies. We may not feel like getting out and connecting with others. We may grab a substance because we're stressed out, because we know that if we're sleep deprived, we actually have an increased amount of anxiety. And so, really, when we're thinking about sleep, it really truly is something that, I think we should focus on first. Although in the lifestyle medicine department, we meet you where you're at. So you may come in and say, I'm just not ready to work on sleep. And that's okay, because then we can talk about some of the other pillars. I also think that we're not as apt to want to connect with others because we're just too tired to go out and, form those important social connections. And we know that social connections are really important in lifestyle medicine, which is why we have the group medical visits. And we're going to talk about today what we do inside of those group medical visits. In our Department of Lifestyle Medicine, we offer one-on-one lifestyle medicine assessments, but then we offer an introduction to lifestyle medicine where we review all the pillars of lifestyle medicine: sleep, exercise, nutrition, stress management, substance use, connection with others. And then we dig into all the different 36 different type of group medical visits that we offer. And Caitlin, why don't you tell us a little bit about sleep and why it's so important, and also what happens in a group medical visit for sleep?
Yeah, absolutely. So, sleep, when it comes to importance, I think everybody knows what that feels like if we're not getting good sleep. And it doesn't just impact, how we feel the next day, whether it's fatigue, concentration ability, or our mood. It really impacts longevity and your overall long-term health. So we see a lot of increased risk in cardiovascular disease. So increase in high blood pressure, or if someone has a diagnosis of diabetes and trouble managing glucose, we have really hard time managing our blood sugar levels if we're not getting good sleep. And so sometimes, people will come to us and say, I'm tired of working on my nutrition or exercise for a little bit. I need a change of pace. Let me try to work on my sleep. And they're happy to report that their blood sugar gets better and their blood pressure gets better. And sometimes they're surprised. They think, wow, I didn't change a whole lot with the other pillars just yet, but simply improving my sleep actually helped me with those other aspects of my life too. And so another big one too that's impacted by sleep is going to be weight management. So for various reasons, simply not getting enough sleep in general impacts your hunger and what we call satiety hormones. So making you feel full, making you feel hungry. And if we're not sleeping well, then we are having a harder time with those hormone regulations. We get a little, as people say, hangry during the day, and we want to reach for some of those sugary foods, or in the morning, almost like, why do I have such a hard time avoiding the donuts at the office or whatever it is? And maybe it's actually not you not having enough willpower, if someone would say that, but you just didn't sleep good. And so those hormones are dysregulated. And so it really impacts our ability to make choices for our chronic diseases. And inflammation in the body, too, I think is a huge factor with sleep. So when we sleep, our lymphatic system drains and gets rid of things that we do not need in our body, and it processes that. So if we're not sleeping well, we're kind of holding on to toxins and things that our body really wants to eliminate. Um, Another chronic disease thing I think that's really important is our memory. And so, higher risk for Alzheimer's, dementia, or just in general, decrease in our ability to store our long term memory can happen without sleep. So, that's kind of where it's important with our long term, or short term, how we're feeling, emotions, and chronic diagnoses. So, hope that answered
Yeah.
your question. I got excited because I
Yeah.
love talking about
Yeah.
it. So,
No, I mean, I get excited about sleep too, as well. I mean, I wear my Aura ring. Do you
mhm.
have your Aura ring? I mean, mine just broke recently and I had to get a new one. And so, I mean, I check in with myself. I believe that what we do best in lifestyle medicine is what we put people in the driver's seat of their health care and we give them the tools to be successful. And, we are our own best healer, right? So we have to
Absolutely.
be able to check in with ourselves and see, did we get a good night's sleep, and were we prioritizing our sleep? And the good news is if we did not prioritize our sleep, we have an opportunity to start again. Every day is the ability to begin again. So I always say, as long as we're breathing and our heart is beating, there's more right with us than wrong with us. And, we can just make the next night of sleep count and do the best we can and not get anxiety about sleep. One thing I suggest to patients is grab a journal, especially write down your worries that maybe you had and let them go, close it, or write it on a piece of paper, rip it up, throw it away. But then, maybe do a breathwork practice or a relaxation practice like you talked about. You are trained in mind body medicine. So I know you teach a lot of meditative practices and practice yoga yourself, and even things like yoga nidra, restorative yoga that doesn't really require you to move your body, but just to connect with yourself and move into that state of relaxation. I think also something that's important that you were talking about with our hearts, if we see things like atrial fibrillation, we sometimes have to say to ourselves, but why? When we have these disease processes, hypertension, diabetes, anxiety, depression, but why? And so maybe there's an underlying sleep apnea that could be happening. And so, I know it's people don't always want to have sleep apnea, but we do
Yeah.
screen for it in our department. And I think that that's really important. We offer home sleep studies. And then we even recommend to our patients, download the Snore Lab app, SNORE Lab, and record yourself and see if you're snoring at night. Because if you're snoring at night, if you don't have a bed partner, then you're able to go, oh, was that me? And then you're able to say, well, maybe I need a sleep study, and we can evaluate you for that. The other thing that you were talking about is, the stress response and the weight problems that people struggle with, that they can't really lose weight. And that's a result of cortisol, right? You
Mhm.
are not really filling up your cup and you're starting your day with an empty cup. And just like our phones need shut down and our computers sometimes need shut down, we need to shut down too. And so I think thinking about all of that, and also just to make note that one thing we learned in COVID was that patients that had sleep apnea or poor sleep actually didn't do as well when they were diagnosed with COVID. And so we know our immune system is really affected by sleep. So I also run the menopause group medical visits, and that's a big issue that presents during menopause. So we talk about that in our menopause group medical visits. And so, how about sharing just a little bit more about what you cover in the group medical visits and how you help people prioritize sleep?
Yeah, absolutely. And something I just wanted to say that came to my mind when you mentioned sleep apnea. I always hear patients when they do get treated for sleep apnea, whether it's a CPAP, dental device, or some other way of treatment, people always say, "Gosh, I wish I did this sooner." So we hear all the time, "Oh, well, I don't want to use this. I don't want to do treat feel better." So if that's you and you're not sure about it, see how you feel with the treatment and then kind of go from there after you're tested. But So in our program or in our group, we kind of break up sleep in a couple different areas. So it makes it a little more digestible, right? Instead of saying, I have to change everything with my sleep, you get overwhelmed with it, and maybe it becomes a poor relationship with sleep. We really try to break it up. Because one really important factor is truly our relationship with sleep. So if you associate sleep with frustration because you're having a hard time with sleep, we have to fix that relationship first. Because if you put your head on the pillow and you're instantly frustrated, it's just not going to go well. So whenever that happens, the first thing I talk to people about is remember that even if you're lying there resting in itself is restorative. Um, all right. Well, due to a little connection issue, we've changed locations, but we're gonna get back to talking about what happens within the group medical visit for sleep. So, a lot of times I'll start off by talking about relationship with sleep. Just if you associate sleep with frustration because you've had a hard time sleeping, whether it's your entire life, it feels like, or it's recent, you really don't want to associate your bed with frustration because then that just leads to more trouble with sleep. And I always discuss too, if you're resting, you're still getting a restorative time. So if you can at least say to yourself, I might not be sleeping, but I'm resting, and really allowing that to be enough for you until your body does allow you to fall asleep, that's a huge change in itself. But then we break down the group into sections because it's really hard to take a pillar of lifestyle medicine and try to do it all at once. That's hard with any lifestyle change. I think every human has been through that before, where you just get burnt out and then you say, I'm done with it. I need a break. So we divide the sleep group into those sections, and those include sleep drive as the first one. So asking yourself, do I actually need sleep? And this doesn't just mean I feel tired. It means I've done things throughout the day that mean I need to catch up and get some sleep. Were you moving your body? Were you also using your brain and doing something creative or at work or at home, problem solving? A lot of us feel that mental strain from our jobs or whatever it is, but in retirement, if someone's not working, they need to make sure they're still mentally challenging themselves. But the biggest component truly is like the physical space of it and moving your body. So even if you feel mentally tired, you need to make sure your body's physically tired as well. So we talk about sleep drive, and then we talk about your circadian rhythm. And what that entails is, are you trying to go to bed around the same time and waking up around the same time every morning? And then obviously every night, keeping that consistent. And that's really important because our bodies are on a clock system. We love a schedule. So your body wants to go to bed at a certain time, it wants to wake up at the same time. And if we're not doing that for ourselves, our body doesn't know what we want. So say our body really, really wants to go to bed and we're not doing it, by the time, midnight rolls around and we go to bed, our body says, I wanted to go to bed 3 hours ago and now I'm trying to stay awake for you. So we really have to be on a schedule. And the clock is really interesting. We talk about it in the group, but other factors in your body are on a clock system as well. So everything gets better when we keep a schedule. And then the last three also are learning how to turn your body off. How do we signal the body it's time for bed? How do we turn our brain off? That's sometimes the hardest one for people, is their brain's going a million miles a minute and they don't know how to get it to be quiet for a little bit. So we talk about how to do that. The journaling you mentioned earlier is a great way to do that. And then the sleep environment, picturing, closing our eyes right now. And as you're listening, if you're in a safe environment to do so, what does your bedroom look like? Like, does that actually support sleep? Is it a restorative place and nurturing and calming? Or when you picture it, it kind of makes you feel like a little chaos. Maybe that's where we start first, is decluttering, or, getting new sheets, or getting curtains that block out the light. Like, what does it actually look like? And then we do talk a little bit about sleep aids and magnesium, melatonin, like what's their actual purpose, and that kind of area of it too. So that's what the group looks like. And obviously we have open conversation, and yeah, I think it goes really well.
I love that. And so, when we talk about even in our teaching kitchens and our food as medicine programs, and we talk about getting prepared to succeed. And, I remember a patient telling me their kitchen was so messy that they couldn't cook in there because the counters were so messy. And this is along the same lines, right? So if your bedroom is a mess and chaotic, you feel like that is just like chaos. And we know that once we clean things up and we have more structure and organization, we just feel better overall. So yeah, and it's whatever feels good to you. I think that's what this is all about, is meeting you where you're at. So anything else you would like to share, Caitlin, about sleep, or what we offer inside of lifestyle medicine at UPMC or inside of these group medical visits?
I would just say, start somewhere, honestly, with sleep. Even if it's not the thing that you feel like would help the most, if it's the thing you feel ready to change, that's the thing to change because then it's the most likely to happen. And maybe right now, listening to this, you don't want to change anything, but you want to sign up for a group, reach out. If you're looking for a different group that might help your sleep as well, I'm all of them. A little biased because I love them all, but nutrition, I mean, that's going to help you. We talk a little bit about that, but really, I would think about doing a mind body skills group just because that's going to teach you ways to regulate your nervous system. And the autogenics practice we teach really helps with the sleep unwind too. So if you think, maybe I can't get in for a sleep group right away, but you want a mind body skills group, um, that would be something that would be helpful that we offer if you're interested too. So, yeah, I think that's about it. I mean, sleep is a lot more complex than that, but when we talk about like the behavior change part of it, those are the things we focus on.
Yeah, and one of the things that we didn't mention is caffeine, and we were talking about how nutrition is important. Well, avoidance of excess caffeine is definitely important. And we also talk about meeting a person where they're at, and we don't go to the buffet and eat the entire buffet, right? We pick a couple things to work on. And so maybe sleep isn't for you to work on right now, but maybe you work on movement, and by moving your body, you get a better night's sleep. Or, by connecting with others, you feel like you've used some energy and you're more rested and calm. Or maybe even doing one of those breath work or yoga practices at bedtime could be very valuable. On my website, wholeheartedmedicine.org, I have a page that has all kinds of meditations on there and podcasts and things that you can listen to. And then also sound therapy. We have group medical visits in sound therapy. You can listen to some sound therapy on your phone or your devices. I'm doing one of the apps like Headspace or Calm or something like that in the evening too. And we'll talk more about that inside of the group. So, or aromatherapy, diffusers, so many different variety of things. I'm curious if you would like to just end with a little breathwork practice or a relaxation practice that maybe they could sort of feel what that might feel like. And if you don't want to lead that, I'd be happy to lead it, but
Yeah.
just going to invite the space to end that way.
Yeah, I'm absolutely fine to do that. I think we'll
Wonderful.
do probably just like a systematic relaxation, kind of like a little head to toe yumminess. I tend to notice this is something that people like to use in their sleep because they can focus on it instead of focusing on maybe what the mind is doing or if they're uncomfortable. So, if you want to go ahead and while you're listening to this, um, join in. If you are driving and listening, please don't close your eyes, okay? But you can still kind of relax other areas of your body. So, as we go ahead and lean into this practice, just go ahead and give it a chance. Even if this is your first time thinking about doing a little meditative practice or deep breathing, give it a chance and start by focusing simply on your breath. So, start noticing what your breath is doing. No judgment. But notice if maybe you've been holding your breath, or maybe all day you've actually been breathing pretty shallow, if it was busy or whatever was going on. And that's okay, your body is doing as it needs to. But in this moment, we're actually going to allow the body to relax. And we're going to do that by guiding the breath in, breathing through your nose if it's comfortable. If you need to breathe through your mouth, that's okay too. But make that in breath nice and deep and as if you're breathing into your belly, and then exhale out through your mouth, nice and slow. You want that out breath to be longer than your in breath. This helps trigger a nerve in your body called the vagus nerve that relaxes us. And with our next breath, we're going to go ahead and start noticing different areas of our body to relax. And if thoughts come, that's okay. It's in the mind's nature to wander. Just let them come and then bring your focus back to your breath. So, our next breath, we're going to breathe in nice and deep and exhale out slow. And I want you to picture the top of your head, your forehead, your eyebrows. Picture them relaxing, softening. And if it feels good to you, you can even visualize like a white light following this pattern as we relax these areas. Or you can just picture them softening. And continue with your next breath, remembering to keep it deep and your exhale long. Soften the facial muscles. Maybe you've been clenching your jaw. Can you unclench your teeth and lower the tongue from the roof of your mouth? Exhaling out what does not serve you. And following that breath to your shoulders. It's okay if you notice they've been kind of close to your ears and tight, but now we're going to help the body by breathing in deep as you can, relaxing, even sighing it out, and letting your shoulders relax away from your ears. Maybe our next breath we send to our neck and our throat, past our shoulders, then moving to your heart. Picturing your heart calm and peaceful, allowing any anxiety to let go through your breath. In our next breath, as we follow the relaxation or white light, allow it to follow down your back, your muscles relaxing, allowing you to lean a little more in your chair. Maybe next, relaxing your abdomen, keeping it nice and soft. You can soften that other area. If you can soften the abdomen, other areas will relax too. Our next in-breath, we keep nice and deep again, and we exhale nice and slow, following it to our glutes and our thighs and our hamstrings. Allow them to soften and actually let yourself be held up by your chair or your bed, whatever you're resting on. Don't resist. Allow yourself to relax into it. And finally, following that breath down to your calf muscles and your feet, allowing them to be heavy on the floor or your bed, fully giving in to your body relaxing, being grateful for this moment, for allowing yourself to rest and relax and find space. And together, I want us to take a deep breath, and we'll pause and increase our inhale at the top of our breath. So go ahead and breathe in, pause, take a little more in, try to fill in just a little more oxygen, a little more healing, and then sigh it out, letting go. And lastly, just notice if your body feels heavier, if there are areas of your body that feel better. And whenever you're ready, if you need to continue on with your day, you can find a little movement in your fingers, your toes. Notice how things feel a little slower, a little heavier. Maybe roll your neck out, whatever feels good to you. Roll your shoulders and open your eyes and continue on with your day.
I want to go straight to bed and it's not bedtime. That was just so lovely. It's such a reminder that if we just take a few moments to breathe, we may not be able to control anything else in the world around us, but we can control our breath. And we can, use that to control our nervous system to move us from the sympathetic fight or flight nervous system into the relaxation parasympathetic rest and digest. And so, just focusing on those tools. And as long as we're breathing and our heart is beating, there's more right with us than wrong with us, and we're safe and we're well, and we're able to really begin again. So thank you so much for spending this time with me today talking about sleep. Thank you for all that you do in our lifestyle medicine department and championing sleep for all of us, because truly sleep is the driver of all health and we all need it. Not one of us can get through this world without it. So
So
may
true.
you, yes, yes, may you all be well. And we'll see you in our lifestyle medicine assessments or group medical visits. We're happy to have you check us out on our YouTube channel at UPMC Lifestyle Medicine. Have a great day, everyone.